Hello, I'm Tim Reichen. I'm at Dartmouth Hitchcock Medical Center. I'm the chief of neurosurgery there. I've been involved with spine surgery since my training back in the 1990s. I've been using the TCS system for about 3 years, I believe, 2.5 to 3 years. The fusion rate radiographically is evident. Just looking at the x-rays on those early post-operative studies, it's quite dramatic, particularly compared to peak. Initially, when we started using the TCS system, the screws are implanted and there was no locking mechanism for them, which often concerns surgeons. So the addition of the locking plate adds very, very little to the profile of the system, but it assures you that the screws are not going to back out. Most of us, if we're going to have these type of procedures, we're going to have a 1 or 2 level, very standard anterior cervical discectomy and fusion. These cages are suited perfectly for those. The ideal patient for any of these standalone type of products is the single level discectomy in a young healthy person that doesn't have angulation, doesn't have excessive kyphosis. The outcome from ACDF surgery is pretty good anyway, but I think what we're looking at is the efficiency of the surgery is better. I think we're getting patients out of the OR quicker, and that also is a significant impact on our patient outcome. I do solidify my procedures with biologics, and the recommendation that I have is to use demineralized bone fibers. I think the titanium design of the TCS, in particular, allowing that additional centerpiece for the bone graft, and the surface technology, the interface with the natural bone, is particularly appealing from the biologic standpoint. This is exactly what we want to do, is create the bone surface interface using our newer technology to create that interface to achieve the outcomes that we're really after. And so this was just a natural progression. It makes total sense that the bone is going to grow to a surface that it identifies with. The impact of this system has really significantly changed our practice. We really can take 2 or 3 cases and we can get 3 or 4 done in a day. It's more efficient. The exposure is faster. I feel very confident that we do not need the addition of anterior plate or anything else. So I think it's really come down to efficiency, and it's improved our practice from that standpoint.